Hello and welcome, everybody. I'm really glad to be here today. This is actually pretty exciting and it's unique for Benefab, but we are going to be doing this webinar today to talk about equine anxiety and soreness, and more specifically, the parallel between those things and equine behavior. So we at Benefab get a lot of customers who come to us saying, my horse has issues with X, Y, and Z. And normally they're behavioral issues, but they know that they're stemming from pain. And I thought this would be a really interesting topic. And I have an amazing equine veterinarian on that's going to be joining us. And we are going to be going over, those topics, as well as an Ask the Vet session that we had some preliminary questions that were sent in that'll be really fun to go over. But before I introduce her to you, I just wanted to tell you how I met Dr. Francheville and just a little story behind that, because she was a really integral part of one of my horses named Papa. And if you've been involved in Benefab or received any of our emails, you've probably read about him. He was a really special part of my life. And I actually met Dr. Francheville at the Equine Global Dressage Festival in Wellington. And at the time, she was, obviously, I'm a big fan of Eastern medicine, and I know Western medicine has a lot of benefits too, and we just hit it off. She has had extensive backgrounds in both worlds, and she actually had graduated from vet school in 2003 and then went to the Chi Institute of Chinese medicine and graduated from there in 2004 and opened her own practice in Southwest Florida in 2005, Sunny Coast Veterinary. And she really filled like an immediate need that we had in Florida, and she specializes in lameness and sports medicine. But what I loved most about our conversation was that she really takes the best of both worlds, the Western and the Eastern veterinary science and medicine, and blends it into this integrative healthcare that, she's transforming horses' lives every day, and really taking cases that are very difficult. And Papa, my horse, is one of those cases. And, looking at them from an aspect of totality and looking at the entire situation and addressing them from multiple angles. So she does a lot of acupuncture, and we're going to get into all of that and talk more about it. But after having this conversation, I, kind of stewed on it and thought about it. And I reached out to Dr. Frenchville and, said, hey, will you help with my horse? And we had just hit every block that was possible with this horse. And she made him so much comfortable. Ultimately, Papa was a wobbler, and it was really sad. We ended up losing him years later, but in that time frame, he went from being so uncomfortable to, she really just improved the quality of his life, and gave me those extra couple of years with him, which I could never thank her enough for that. But anyhow, she now has two practices in Nova Scotia, Canada, and then also in Florida. So I'm really excited to introduce her to you. So welcome, Dr. Carla Francheville.
Thank you very much. What a great introduction.
Yeah, no, this is really good. So I know that you specialize in lameness, but just tell me, in sports medicine, tell me a little bit more about that and what made you passionate about practicing and specializing in that.
So I grew up with the first thing that I did at 6 months old was driving past a pasture of cows, horses, and sheep. I would say horse. So I was passionate about horses from the time I was born. I finally got my first pony at 13 years old, quit swimming, started riding, and had always an interest through Pony Club in lameness. And, you do a little bit of the lameness stuff. And I just loved that, but never thought that I wanted to be a vet at that point because I didn't think I could euthanize animals. So I actually went to university for physical therapy in humans. And realized in my first year of, so that's all functional medicine. And I think it's just where my interest always lied. But in my first year, I realized I didn't necessarily want to touch human beings, and did some volunteer in small animal, and realized that actually I can euthanize animals. You only have to euthanize the ones that you really believe that they should be euthanized. And went straight tracked for vet school at that point, right after my first year of university. So it just kind of evolved. I always had horses. Of course, I did 3-day through Pony Club, and there's always soreness issues and behavioral issues. And I just think that through that experience, I always kind of had the mind that broke down what the issues could be. Often behavioral issues being pain related. The year that I went for my interview for vet school, I had a friend that was in vet school, brought a horse by and said, Carla, look at this horse. And I said, oh, he's lame right hind. And he was like, no, this horse is sound. We're sending him home. So I just always like had an eye, kind of like when you're a jumper and you have an eye for a distance. I always had an eye for it. So it's kind of what I naturally evolved to do in vet school. And it's always just where my mind was the most interested, and where I had the most was seeing animals in pain and thinking of ways that we can get them more comfortable. And so I had acupuncture all through vet school, went into the Chi Institute of Chinese Medicine in Reddick, Florida, which I feel is the best acupuncture school in the world, right after graduation. I graduated from there a year later, took all of the advanced courses that I could take, the herbal course. I just couldn't get enough. Their courses are wonderful, and it's so holistic. It's Chinese medical rather than science-based. So that's how I practice. Basically, I look at a horse and I see them from a Western medical standpoint and also an Eastern medical standpoint. And just, horses are complex, just like human beings. And so there's not often one problem. There's often layers of problems.
Sure.
And I think my analytical mind just works in that way, that I like to peel apart layers of an onion and get to the true source and fix every little issue contributing.
And what do you find with that correlation between, the soreness or lameness and the behavioral issues? Do you see that very commonly? Do you find that people ignore soreness or don't recognize it because they're just looking at it from a behavioral standpoint?
Absolutely. All the time. I actually I can't think of a whole lot of cases in my 17 years as a veterinarian where something is purely behavior-based. They're in 5-element theory. I'll go really quick. Fire, earth, metal, water, and wood are the 5 elements. And we're all humans, animals. We're all one or a combination of a couple of those. Fire element animals, I'm not going to get too far into it, but the yin and yang organ are heart and pericardium. In Chinese medicine, the heart houses the mind. So a fire horse is going to be more prone to primary behavior issues when they're out of balance.
Okay.
But for the other elements, I throw that in because it's super interesting for most people, and that's kind of what my clients get like super excited about when I talk about 5-element theory. Those horses, and that's where the holistic approach works the best, because when I look at a horse and I say, okay, you're a fire, you have behavior issues, maybe it's pain related, maybe it's not with you, but if you're an earth, metal, or wood, it's probably not primary behavior. I can tell that right away. With water, their emotion is fear, so sometimes that is behavior based as well. They don't even have to be out of to have that, but for the most part, behavior issues are not primary. They're the time due to some sort of pain.
Sure. So with those, with those elements, no, that's okay. With those elements, because I think that people will find this fascinating. And that's one of the things I found most fascinating when I brought Papa to you. So walk us through that a little bit. Like, what makes you, how do you recognize what a horse is, and, walk us through that process.
It's super fun for me, because this is why Western medicine is amazing. And we have, when we go to see a horse, we do a physical exam, and we're basically looking at the horse from the tip of their nose to the tip of their tail, and we're finding things, comparing what we're seeing with normal. That's fascinating alone. But then Eastern medicine, I think because it's so different than what we do in Western, and what it brings to the table, especially when you see it work, is so amazing. It gets me really fired up and excited, and for the most part, all of my clients as well. So I will often, when I go and do an initial visit with the Eastern physical exam, the Western physical exam, we also do, a history, and then I kind of go through 5-element theory. So I have an idea when I look at your horse, what element that horse is. But then I have questions, and then I'll usually, if I'm not pinpointing exactly, at least if the owner isn't kind of catching on to what their horse is, I'll give them examples. So I'll run through that very quickly. First of all, in Chinese medicine, we diagnose in 8 different ways. There's 8 principles. 5-element theory is the primary and my favorite, because I can look at a horse and say, that's a wood horse, you're a wood person, that's not a great match.
Oh, interesting. Interesting.
Yeah, and sometimes that actually leads to a behavior issue. So in 5-element theory, you've got fire. Fires, I always compare to dogs, because everyone kind of can really get that quickly. The fire is a poodle. That's the dog that comes to the barn and goes from one person to the next person, the next person, the next person. Hi, hi, hi. Super friendly. That's the horse on cross ties. That's walking forwards, backwards, sideways, pawing, looking at you, like playing with the cross tie.
Very extroverted.
Extroverted, playful, curious, friendly. That's the horse that you say, here, you're not only going to do 3-day where you get 3 disciplines, but let's also do some cattle work on the weekends. And the horse is like, cool, like, the more you can throw at me, the better. That's the horse that goes out and they're like, what's next? Like, let's not go back to the barn. Let's keep going.
I think that's my horse.
I love fire.
Yeah.
And actually,
that's great.
When you look in the world-class arena, you've got a lot of fires. Those horses don't know what to say. Then but yin and yang organ, fire pericardium, heart pericardium, and heart houses the mind. So those guys, when they're out of balance, they can get a little bit manic or anxiety. So you have to walk them and manage them. Earth is like the golden retriever. That's the horse that you're picking out his stall, his head's over your shoulder, mouth on the fork where you can barely pick, and he's like not letting you move. It's kind of like the golden that sits on your foot, leans up against your leg, and says, just touch me and I'll be your slave for life. That's very calm. Those are the horses that people say are bomb proof. Takes them a lot, they'll go anywhere, do anything, they're pleasers. They do have their emotion, where the emotion of a fire is joy. The emotion of the earth is worry. That's like, think the golden, where'd you go when you went to get groceries? You've been gone all day. I missed you. Like, those horses will tend, spleen and stomach are the yin and yang organs. Those horses will tend to get stomach ulcers, that kind of thing, if they're out of balance. Then metal is like the greyhound, aloof. You walk in a greyhound's house, they lift their head, they wag their tail, and then they put their head back down. And that horse that is has one person that's kind of their person, and otherwise they stand in the barn and you don't know that they're there, if that makes sense. That's the horse that you say jump, they say how high, because they don't know how to say no. They do great lesson horses. Their emotion is grief, and that's the horse that you often feel like you want to go up and hug. Their yin and yang organ is lung and large intestine. Those horses will develop recurrent airway obstruction, COPD, if they're balanced. And then the water, we don't see a lot of those in the competitive world, because their emotion is fear. That's a horse that sometimes you think, horse beaten, was this horse abused? Not necessarily. They're just fearful. They make good brood mares on a pasture. Um, so those horses, kidney and urinary bladder are the yin and yang organ. Kidney controls bone in Chinese medicine, and so those horses will develop arthritis at a young age. Then one of my favorites as well is wood, and I think Papa was a wood. And wood, the yin and yang organ are liver, gallbladder. Liver, gallbladder control, just making this in general, sinews. So those horses will get tendon ligament issues. Think of him being a wobbler, you know, and what that means for the ligaments in between his cervical facets. Those horses will often develop tendon ligament injuries. They're more prone to that. So, but their personality is very confident. It's like the opera singer, like, I am here. You may watch me on the
And that was Papa.
I love wood. I love them. They're so much fun. And my favorite combo is a wood fire, because the wood's emotion is anger. So they can be a little bossy, and that's the horse where I'll be doing acupuncture. They might try to stomp on my foot just to tell me, like, I'm not, you know, not like agreeing with this. Yeah. So my horse currently is a wood. He's a lot of fun. He'll kick out when I give him a whip just to tell me he didn't like them, you know, but he just keeps going. They're talented. They often just think they know better. So that's 5 elements. So I'm getting really long here, but I pretty much know, because when you do acupuncture, it opens you up to the energy. I can take a look at a horse and say, boom, I know who you are. But then I ask the owner, kind of go through a few things. And like you said, oh, that's Papa. And my horse now, he's a fire. You can get it just from the little descriptions. It gets really more in depth, but that's kind of a quick overview.
No, that's fantastic. So how do you, when you address, you know, a horse, you just said, so do they go hand in hand with 2 elements normally? A horse is kind of a combo?
I rarely ever see one that's a straight 1 element. It's almost 2. And usually have one that's like, you're 70% this and 30% this.
Okay. And so when you, obviously I know you do practice some Western medicine, and we use that, which is fantastic. But I've always said, you know, it seems like Western medicine addresses the symptoms, whereas Eastern addresses the cause. So I'd like to hear a little bit more on, I know you use a lot of herbs in acupuncture, and to a lot of people, I think that haven't been exposed to acupuncture are, you know, they're just skeptical about it. You know, and they don't understand exactly what it is. So tell us a little bit, tell me about that, and how acupuncture works, and what you've seen with it.
Sure. So Western medicine, we both agree that we can't do without it. And my practice is, some people know that I do Eastern, some people don't. Some people don't know I do Western. But yes, a lot of times people will approach you like, oh, you did acupuncture on my horse. Can you come do acupuncture on mine? You know, you did acupuncture on a friend's horse. And so that's how they know me. And then I talk to everybody about why the combination of Eastern and Western medicine is so important. I get excited and I'm all worked up. The reason why it's important, Western medicine, we have developed amazing diagnostics. In Eastern medicine, you can do diagnostics, absolutely, and there's a diagnostic acupuncture point scan, which many of my clients feel is as effective as a 4-hour pre-purchase exam. I can pretty much do the scan in 5 minutes and tell you what we're going to find.
Wow.
A full pre-purchase. I never stop there. Then I go and actually see with my own eyes with ultrasound or x-ray. There is no way to replace Western medicine with Eastern, but when you combine the two, the success rate with diagnostics and treatments skyrocket. So in Western medicine, we are really great at diagnosing and treating acute disease. Where Western medicine fails is in the treatment of chronic disease and in preventative. So where Eastern fills in the gaps is Eastern medicine is amazing at treating chronic disease. You can take a person or a horse who has had recurrent airway obstruction for 20 years and make them breathe again. And nothing else does that. You know, Western medicine doesn't do that. So using the combination, or for example, I have a horse that has sore hocks. The hocks are inflamed. The joint fluid is watery and it's yellow and it's full of white blood cells. Doing acupuncture is going to help move chi and move blood and promote anti-inflammatory, but it's not going to go into the joint and fix your joint fluid. So that's where injecting the joint in combination with acupuncture really makes a big difference. So what I'll do with a horse that has sore hocks, they often also have a sore pelvis, and we'll do acupuncture for their pelvis and for their stifles and for their lumbar spine, and then we'll inject the hocks as well. And I know I totally got off topic, so bring me back so I can answer your
No, that was fantastic. So, I mean, that's how you're combining the two. And I'm just interested in what exactly is acupuncture? Like how does it work for people who haven't been exposed? I mean, I've seen acupuncture work, and what you did, I mean, it's incredible. And I really believe in it, but a lot of people have never been exposed or are very interested in, maybe they've even seen it work, but they don't understand it.
Sure. Okay. So there's 14 channels of energy in our body. And each channel starts or ends on the feet or the head. So where one channel ends, the next channel starts somewhere else. For example, what we call ting points are down on the feet of a horse. And the ting points, you'll have lung 11 going over to large intestine 1. And so basically there's a flow of energy that when the energy, or chi, everyone's heard that term, when chi slows down or stops, that's when there's disease or there's pain. And so they found 2,000 years ago, they've figured out these channels. Now the channels have names that don't correlate necessarily with Western medicine because they didn't do vivisections. They didn't know, they didn't open up bodies to see what was what. But that's why the heart houses the mind in Chinese medicine. You know, lung is lung, spleen and stomach are spleen and stomach, but they basically had to surmise everything else. We now know what each one of those organs does. In Chinese medicine, basically the channels were named many hundreds and thousands of years ago. And basically where there's a blockage or a stagnation of energy, there's pain. When the energy is too low or too high, there's disease. So it's as simple as that. And when we do acupuncture for Western-minded people, they've actually measured frequency at one acupuncture point at one end of a person or a horse's body, and they've gone to an acupuncture point at the other end of that channel, and the frequency measures at the exact same level. So it shows you, and also from a Western medical perspective, it's where you have a collection of nerves, blood vessels, nerves and blood vessels closest to the surface. So what they found years ago, not knowing why they found that, we've actually figured out. And they've even done cool studies where they've taken people with comparable back pain and they've done acupuncture on one and not on the other. And they've done a blood transfusion from the person with acupuncture to the person that didn't get acupuncture, and they found the same pain relieving results because acupuncture releases dynorphins and enkephalins, beta endorphin, and serotonin. So the dynorphins and enkephalins are equivalent to what's released in your body when you take morphine. So, and then beta endorphins we all know about for anti-anxiety, and serotonin, you know, all behavior neurotransmitters. So that gives you a good little explanation of the Eastern and Western side of how it works.
Yeah, that is fascinating too. I didn't realize that it releases basically all the happy hormones.
You got it.
That's really interesting. So actually that, I know we're going to be doing this Ask the Vet section here in a few minutes, but I want to jump to one of these questions because it goes hand in hand with that. And so we're going to be working backwards now, but we'll just go with the flow. So, because this is really interesting, I actually had this thought before having you on here. I was thinking about, with soreness and anxiety, I think, and I had a bad accident myself years ago, and it was interesting how the pain actually causes me to have anxiety, and years later, I'm, healed, and I don't really ever have any pain. But if I ever do have any sort of pain in my neck, I had a neck fracture. It's interesting how that will spur anxiety for me. Like it's almost like it starts to like build up, like almost like a cortisol, like a stress response. And what's interesting is I found when I have that, I start to lift my shoulders and I start to, become really tense. So probably acupuncture would be really helpful for me. um, but beyond that, we had this question, and I feel like that cortisol and that tension in horses would probably lead to more injuries, just from a tightness standpoint. But one of the questions was from Caroline Ashley in Spring Branch, Texas. And she said, with your experience, do you see mares or studs being more sore than geldings from a hormone standpoint? So I'm really interested in your take on that.
Absolutely. I think, one of the things that I discuss with mare and stallion owners is they have an extra element that we have to deal with. And hormones, let's go with a stallion. Hormones make them have to check out their entire environment at all times and make sure that their herd is safe and taken care of. And, whether they actually have a herd or not. I've had several stallions, and, a horse comes onto the property, that's their herd in their mind. So there's always a level of angst, with those guys. And they are constantly having to deal with the hormones causing those extra elements to come in, where they are often very, very tense and worried, stressed out. And like you said, the cortisol levels peak in those guys for that reason. Cortisol causing discomfort basically in all the tissues, and also high cortisol levels for long periods of time cause weakness of the sinews, tendons, and ligaments. That's why cushionied horses often have tendon ligament injuries and having their tendon and ligaments let go. So from a stallion perspective, you've got a lot of behavioral, you've got those hormones causing anxiety and lactic acid buildup and just tenseness in general. And then with mares, a lot of times, yes, you've got the behavioral issues that come with hormones, but also, when they're cycling, even when you have them on Regimate, their follicles continue to turn over. And for a lot of mares, follicular development causes pain and discomfort. So a lot of times when I'm doing my diagnostic acupuncture point scan, we get back to the bladder or back shoe points, is what we call them in Chinese medicine. We get back to the bladder points, and they fire off in the reproductive bladder points. So there's a lot of pain, locally where the ovaries are, and in the back shoe points or acupuncture points that correlate with that. But also they often will pump their back or tense their lumbar spine just to kind of, just due to the pain and the discomfort. That can in turn play into behavioral problems. So there's a big cycle back and forth with stallions and mares. Behavioral leading to body changes causing behavioral because of all the hormones. So geldings have an easier life for sure.
Yeah. Oh, that's fascinating, because I think that's one thing that we don't, I think even in ourselves, like we really discount hormones, many times, and we look at all the, I guess, more noticeable things or things that we interpret as, and we look at our physical bodies rather than looking, within, and because we can't, I guess it's out of sight, out of mind. But that's really interesting. So since we're on this Ask the Vet topic, we just kind of jumped right in. So I'm now working backwards, but this is a really interesting question. But this is from Elena Flaherty in California. And I know, so Dr. Francheville, people I guess don't know this, but you're a dressage rider.
Yes.
Yeah. So, and that's really interesting too, because a lot of equine veterinarians don't have the experience of that they're riders. So you understand the sports medicine from that aspect as well. So I think that this is a really interesting question for you specifically, but she asked, how do I best manage muscle health in an FEI dressage horse?
Okay. So basically I look at, any horse in any level of work, we have to manage muscle health, but for an FEI dressage horse, I ride FEI as well. Actually, we met when I was riding my 23-year-old Trakehner gelding at the St. George at the dressage championships at Global Dressage, right? At the Equine Festival. Yeah. So I had been his vet from the time he was 12, and at 23, everyone would have sworn he was a 10-year-old horse because I ride my horses from the perspective of balance and maintenance and prevention. Muscle health is a very important part of that. I came in and bought everything out of your store, like literally, like probably 5 of everything. I bought your pull, your basically the whole bridle is full of Benefab products. The polos, the scrim. I think that that's number one, very, very important. You can't just do acupuncture. You've got to treat the horse from a holistic approach. Yes, joint injections are important. Yes, doing other, doing Adequan, Legend, polyglycan, whatever joint supplements and oral supplements you like, that's all important. But we'll kind of go to, I'll do them as bullet points. One, you've got to plan your horse's workouts from the perspective of not allowing them to become muscle sore or preventing it as much as possible. Meaning long warm-ups, but effective warm-ups. You don't just get on and let the horse kind of plunk around. Make the horse sit down, bend their pelvis, power walk into the bridle. Don't let them tense up. Long warm-up, long cool down. Again, the cool down, power walking. They have to use their muscles, but you have to let them let down. Not using cold water right after your ride. Using warm water, or at least, letting the horse, a sponge or something, not putting freezing cold water on warm muscles. Doing workouts that make sense, developing that with your trainer, or if you don't have a trainer, by yourself, knowing that you've got to warm them up longitudinally and laterally. Not walking straight lines. We're walking circles. We're walking, bending lines. We're doing lateral movements, leg yielding, doing half pass, and all of that in your warm up at the walk before you even get to trotting and cantering. For some horses, cantering before you trot, going from walk to, doing different things. So if I'm working on a lot of canter half pass or canter half pass zigzags today, I'm not doing that for the next 2 days. Figuring out what movements, canter pirouettes. If you work those hard one day, you don't get on and work them hard again the next day. Maybe, and it makes sense before a horse show to go through all your movements, but not overworking any one area at any one time. So that's really important for muscles, because thinking when you're doing lateral movements, they're using different musculature than when they're doing longitudinal movements. If they're doing a straight line of tempi changes, that's different than doing half passes or canter pirouettes. And then again, lifting muscles, always keeping your core engaged, making sure the core is the most important part to keep the whole horse together. So at all times, you're having them use themselves in a way that they're bending their pelvis to bring their back up and supporting their back with their abdominal musculature. So all of that's important. From a veterinary perspective, if you have a problem, your vet will do an exam, but also possibly if you feel like there's a muscle soreness problem, look into blood work to see if there are any deficiencies and that kind of thing. Preventative with acupuncture, with the Benefab products. I mean, what you're doing, when I tack up my horse, the first thing that happens is the horse comes out of the stall, gets his scrim on, the quick wraps you can put on. while you're grooming. I groom, peel back, groom, put it back on, and I'll even saddle on, put the scrim back over, pull the scrim off right before I ride, either the polos on, or if I'm just using, if I'm in a hurry and I'm using my quick boots, put the quick wraps on before. So that's a big part of it, because you're going to warm up the horse's body before you ride. Even when I have my horse shod, he's standing in the polos or the scrim, because think when the farrier is working on them, they're standing hold, stretching out their legs, standing in one position, they get very, very tense. So with Benefab products causing, again, movement of chi, movement of blood, you've got the magnets sitting over acupuncture points, and the far infrared alone is going to move chi and blood. So, and get oxygenation to the tissue. So that's a big part of prevention for me. Acupuncture is a big part of prevention. Chinese herbs. So, but you need the right vet to diagnose the horse, to know what herbs to put them on. You can use those preventatively. A lot of times we're using them for treatment, and then spot treating kind of in the future once we've got the horse on an herb for them.
Sure. No, that's really helpful. So that's actually, speaking of, you said you basically have your bridle covered in Benefab pole pads, and that's probably it is definitely our most popular entry level product. People come to the store and to our online store, and they purchase that, and then they normally come back and start building off of the pole pads. But one question I would have for you is, how do you, it's kind of building off of your answer, but how do you find that the pole plays into the rest of the body? Do you think, like, if the pole is out, is everything else out of place? Like, what is your, I guess, how do you find that is playing into your practice just generally? Do you see a lot of issues surrounding the poles?
Yes. Do I ever see a horse that doesn't have a pole issue? Rarely. Because we get on these guys. First of all, they take a lot of tension right there. They take a lot of tension in their TMJ. TMJ plays into pole. So I feel like these guys, anytime a horse is tense, everything, just punches up. Also, we have a lot of dental problems, and a lot of vets, for example, don't get the ramps or the hooks in the back of the teeth. And a lot of non-veterinary practitioners out there just go in and they scrape a little bit of dental enamel and call it a day. So tenseness, dental problems, and what we're doing to them. We're a lot of times not riding them from behind, getting them to bend their pelvis, bring up their back, and come down into the bridle. We're saying, hey, come to me. So all of those things play a major part. So I rarely see a horse that doesn't have some sort of soreness in their pole and their TMJ. And when there is soreness there, that is, I'll bring that back to humans. If anyone's ever had a neck problem, if you have a neck problem, you do, I do, because of several, accidents, mostly horse related. When your neck is out, your pelvis is out, your knees become I had a period that I wasn't taking care of my neck issues, and I started doing Zumba, and my knees were so painful I couldn't do Zumba anymore. It wasn't my knees, it was my neck. So is probably the most important source of whole body health in the horse. When that's locked up, it translates like dominoes all the way down the spine. If the spine isn't right, then the horse isn't right.
Sure. Yeah, that that actually better explains this, because we get so many customers who will write into us saying, we've heard everything. Barrel racers saying, hey, I bought this pole pad, my horse is turning better. We've had dressage, riders saying, all of a sudden my horse is, actually getting his tempi changes correctly. So it's obviously affecting that hind end, and they're able to push better from behind. And it's interesting that you say, they're able to utilize their pelvis as they should and really come into the bridle and have that correct frame. And I think we see horses all the time that are ridden completely backwards, and their backs aren't up and they're not using their abdominal muscles. And Yeah, and obviously that correct posture is really important in for us too, for athletes.
Absolutely. And when I use the pull pads on every horse, every ride at a horse show, it doesn't matter. That's the one I can't do without that at all, because I feel like when they have the pull pad on, it basically causes relaxation and pain relief there. So they're not thinking hold and tense in my pull. They're thinking relax there. Now the rest can follow. Now I'm going to allow you to push me better from behind. I'm going to bring my back up, because when this hurts, nothing else can function. And when this feels good, everything else can function.
Yeah, that's super to know. So I want to, I know you're a super busy lady, so I don't want to go way over time for you, but I do want to read you this last question, which was from Megan Thomas out of Georgia. And this is kind of jumping to a different subject, but I think it'll be really interesting for people to get your take on this. So she says, I know that vitamin E, magnesium, and other mineral deficiency can often be linked to anxiety and soreness. What are the signs of this, and what do I do if I suspect it?
Okay, yeah, that's a very interesting question, because there's so many times that we get that call when my horse is just acting weird. Basically, if your horse isn't acting normal, call a vet, and hopefully you can find one that's a combination of Eastern and Western. Because if you're a straight Western vet, you can come out and you can say, I would look at that and say, let's do some blood testing. Let's check vitamin E. Let's check selenium if you're not in a selenium-rich environment. Let's check magnesium and other vitamins and minerals, ones that are within our capability. And let's just be sure that there's no deficiencies there. If there are no deficiencies, then we have to figure out, where that anxiety is coming from, where the behavioral problems and the muscle soreness is coming from. But a lot of times, we do have vitamin and mineral deficiencies. If the horse is on a good quality feed, we shouldn't. But a lot of times horses are super easy keepers. We're not giving them enough, and we're not adding ration balancer. So that can absolutely happen. And here in Nova Scotia, we have soil that's deficient in vitamin E and selenium. So we see a lot of behavior problems for that reason. So I would say anyone who's finding that their horse is not acting normal, call a vet, but one that does a combination of Eastern and Western medicine. Because if we do the blood test and everything's normal, yet we can diagnose them another way. When I talked about the 8 principles, tongue and pulse are important. We can look at the tongue, we can look at the pulse, we can do diagnostic acupuncture point scan. A lot of times they'll come out positive, maybe on the Lyme, EPM, herpes point. And that can tie into vitamin and mineral deficiencies as well, and cause basically general tissue soreness. So there's a lot of things that can be picked up by a practitioner of both that might not be picked up with one or the other. But I would say just call out a vet who's going to be able to treat regardless of what it is. If it's just, there's no necessarily primary muscle issue unless you're overworking your horse without having gotten them legged up or in shape properly, that kind of thing. Most of the time when I see these cases, there's an underlying problem.
Okay. Yeah, that makes perfect sense. And actually, speaking of calling a vet, so I do want to mention, because I'm sure, I know we're running out of time, but I have a ton more questions, and maybe we can even do a second webinar, to build off of this one.
Absolutely.
That would be really fun. You've been a wealth of information. I'm sure people watching are going to be wanting to ask a bunch of questions about their horses. So speaking of that, you do offer phone consultations, correct?
Absolutely.
Is that? Okay. And you can do those remotely. I know you're in Nova Scotia now, and we have people all over the country and really customers all over the world. So that will be really interesting for people. And I'll for everybody watching, I'll link Dr. Francheville's information below, and be able. So if you want to get in touch with her, you will be able to set that up. But this has been super interesting, and I'm sure people are already deciding what horse, what elements their horse is, and they
So
probably have a lot of questions. But we'll have to do this again. And I so appreciate you coming on.
well, I appreciate you asking me. This was a lot of fun. This is the thing, all of this, I'm just so passionate about it, and it's so exciting for me, So I do see patients in Nova Scotia and in Florida. I also am licensed in New York. I'm in Westchester. Thinking about starting a third practice there. But I'm also basically raising the children that you hear in the background every once in a while. So I am available regularly to do phone consultation. I also have certified acupuncturists and chiropractors in each area that I train personally in my methods as well. So we can see patients in any of those three areas. And otherwise, I am happy also to consult with clients' veterinarian and give them, work with them as well. This is what I love to do. So I'm completely open, and even if it's a matter of just a quick consultation to figure out what your horse is and what that means for you and how even you should treat that horse as far as, this is his element. So you're a wood. I can't come toe to toe with you. I have to finesse you. That give a fire enough to do, put some stuff in his stall. So that kind of stuff is fun for me as well, even if it's not talking about medical issues per se.
No, and your passion shines through for sure. I think that's so great. And do you ever do video conferencing, like a video consultation? Have you done that in the past? Okay.
Yeah, where they can.
Yeah, because that would be.
We're talking to the horse in person. Yeah, I mean on video.
That's really neat. Sure. Yeah. Sure. Well, fantastic. I'm sure that I will be linking all of your information below. So I'm sure that people will be reaching out, and people are going to be really curious. And I just really appreciate you coming on, and we'll have to continue this
We'll have
for
to
sure.
make it a series.
Yes.
All right.
Indeed. Thank you so much, Dr. Frenchville. I appreciate it.
Thank you, Kat. Have a good day.